morning and thanks for joining us on San Diego Living. I'm Renee Cohn. New moms working to get their body back might be surprised to see the octo-mom's bikini-clad pic on the cover of Star magazine just 1 year after her big, and I mean big, delivery. Nadia Suleiman claims her 150-pound shrink down is a result of a great workout routine and helpful creams. But we're not so sure. Here to share their opinions, plastic surgeon Dr. Barry Handler and American Council on Exercise educator Jessica Matthews. Thanks you guys both for being here today.
Thanks for having us.
Dr. Handler, we'll start with you. I mean, we look at her body and it looks amazing, and to think that there was at one time first 6 and then 8 children in there, and look how smooth and free of any flapping skin or scar tissue there is. Could this really be possible?
Yeah, I agree, Renee. Somebody did a great job. I just don't know who. No, it's pretty spectacular when you see the before and after pictures, and it certainly does make one question. I don't know the woman. If I did, I couldn't talk about it. But there are some things that make you want to question her story.
Typically, when a woman has a pregnancy, even if it's just one child, there is, there's some stretch marks, there might be some scarring, and in Kate Gosselin showed us with the John and Kate plus 8, after she had her kids, what she looked like with a lot of her skin sagging, and she got a tummy tuck, and so we've had the opportunity to see, what that can look like. Is it medically possible to look like that without any kind of surgical procedure?
Well, when you break it down, there's a skeleton which grows from being a child to being an adult, but once you're an adult, it really doesn't change much, and so that's going to be pretty rigid. The muscle naturally contracts, so you can tone up muscle after a pregnancy when it gets stretched out. If it's splayed apart, it's hard to bring the muscles back together again. The real key thing is the fat in the skin, because fat, once you accumulate fat cells, they'll shrink up, but they don't go away. Skin, unusual. Now, I mean, she's 34, so she may still have some elastic properties to her skin, but that much skin retraction, very unusual.
You were also saying you were noticing something about the slit of her belly button.
Yeah, if you take a look in that magazine, there are some articles after her article where they show unoperated abdomens, and the belly buttons are more rounded. The slit-like belly button that you see in her pictures is again somewhat suspicious. I can't say any more than that, but yeah,
I think you've said a lot. So Jessica, we turn to you because as an exercise educator, believing in fitness, there's a lot we can do, but would it be possible, with crunches and aerobic activity and weights, to look like that after, giving birth to 8 children?
Right, and I think Dr. Handler touched on it pretty nicely is, there's certainly things we can do in terms of building muscle and creating that tight layer below the skin, but really skin elasticity really depends on 2 main factors, which is going to be age, which she does have on her side being 34 years old, also genetics, so she may also be, a bit blessed in that department, but certainly, if you see some of the pictures, the before with the stretch marks, and as we know, creams haven't been proven to be a method that can completely erase stretch marks, though certainly some preventative measures beforehand, using lotions, not even a special cream, but really conditioning the skin properly beforehand can certainly help with that. Also, losing weight in a moderate fashion, 1 to 2 pounds per week, can certainly help to keep that skin a bit more elastic and retain those properties.
Instead of losing a significant amount of weight at one time.
Correct.
Now, also it's interesting because, she has 14 children all in all, 6 that she had previously, and then, the 8 now. Exercise takes time, and what is the realistic time frame that someone would need to take to exercise every day to get a body like that?
Right, now really, we are talking a year post-pregnancy, so I estimated, she mentioned in the article losing about 145 pounds, so it equates to a little bit over 2 pounds, is about 2.6 or so per week if she was actually losing it at that rate. So it is possible to lose that weight in a steady fashion. In terms of exercise, I think a key thing here there for, you know, new moms is you can sneak in exercise throughout the day, especially as your children continue to get older. You're getting that exercise, chasing them around and doing those things. But as she mentioned in the article, she actually devoted time in the evening to exercise. Some studies have shown that exercise in the morning tends to be best for moms, kind of sets the tone for the day. And really, I mean, start out gradually. Best recommendation I can make, you don't need to devote a full 60-minute block to exercise. You can take a 30-minute time frame, break it up into 3 10-minute bouts throughout the day, and still accumulate and reap those benefits.
Great. Jessica Matthews and Dr. Barry Handler, thank you guys so much for being here today. And I think that we learned a lot, and we have an idea of if she really got this body naturally. But we'll let our viewers decide.